inclusion as part of the Move United Leadership Conference. My name is Carolyn Stott, and I'm a program manager with Move United, formerly Disabled Sports USA. We would like to thank the Bob Woodruff Foundation for their long-standing commitment and support for allowing us to bring you this virtual opportunity. For those who missed any previous sessions, recordings and session resources can be found on the conference webpage. This is the same webpage you used to RSVP for this session. Before turning the show over to our speakers today, I would like to go over a few housekeeping items. First, all attendees will be on mute to minimize distractions. Please use the Q&A feature at the bottom of your screen to submit questions rather than the chat. Feel free to use the chat function to introduce yourselves. Make sure to send your chat messages to all panelists and attendees to introduce yourself to the whole group. And with that, I'm going to turn it over to Kelly Bonner and Casey Herman for rallying your troops, engaging your community for inclusion.
Thanks, Carolyn. Appreciate it. So I'm going to start off the presentation, and then Casey's going to join in just a little bit later. And we are both from the National Center on Health, Physical Activity, and Disability. We are a grant funded through the CDC. So they fund 19 states and 2 national centers. And so if you've never heard of us, our sister organization is Special Olympics. And then there's us, who's no one's ever heard of, and we are the National Center. So they really have a focus on intellectual disability, and that's where their federal funds go. And then we kind of cover physical disability, but as well, we cover the whole spectrum just because we realize we don't really live in silos. And so all of our information and stuff that we put out is usually geared appropriately for all abilities. You can go to the next slide. So I'm on the right of this screen. Like I said, my name is Kelly Bonner. I'm Associate Director of NCHPAD. I have brown hair. In my picture, it's straight. In person right now, it's curly. Welcome, COVID. I'm wearing glasses, a gray sweater, and a NCHPAD polo. Dr. Casey Herman is joining me. She works on our implementation science and evaluation team. She also has brown hair. It's straight both in her picture and in person today. And I can't really see her clothes. I think she has on a gray cardigan as well. We're like matching. And so we'll both be presenting for you today. And we will go ahead and get started just so that we make sure that we leave enough time at the end so that we can answer any questions that you guys might have. Next slide. All right, so we know that you guys really, well, first, we're used to doing this in person. We work and do trainings all across the United States, and always, we know the best delivery is usually in person. So we like to do this charrette style. We like to have engagement. And so this is very different for us by doing it in a webinar format when we can't talk to you guys and have an understanding of where you're coming from or what your background is. But because this is Move United, and we assume where the majority of you folks guys are coming from is some type of an adapted sports setting, hopefully. We tried to gear this presentation towards that. But if you guys have questions that are in a different area, know that we work in public health, and so we kind of work across all the spectrums. And so while we tailored it to your organizations today, if that doesn't fit, feel free to ask questions for a different type of engagement. But as we look at the adapted programs, we know that you guys often go unnoticed. We are actually housed out of Lakeshore Foundation in Birmingham, Alabama, and so we get that feeling of what an adapted sports program is because that's where we live and our home is. And so we know that they go unnoticed. We know that they're under-recognized. We can be out in our community and someone will ask where we work and we're like, Lakeshore Foundation, and they're like, who's that? Where is that? But we know that these programs are also interested in engagement from the communities around them. They want them to come to their meets or their practices or their games and their different competitions that they have, but they're not necessarily sure how to engage communities. You know, typically we don't have a ton of funds to like put up billboards and advertise. And so they're just not sure how to facilitate that effectively. So at NCHPAD, we are using a knowledge to action framework, and that really exists to implement evidence-based programs into communities, but we're gonna take a look at it and see how any program can really fit into this framework. So NCHPAD is using this type of framework to engage the community stakeholders in the process and make them a part of implementing the programs to make sure that they're inclusive people with disabilities in their communities. So today we'll briefly discuss what this model looks like, discover how and what an inclusive health coalition is and how it might help your community engagement, and then see which part of this framework might work for your organization by giving some real life examples and moving on. Next. So this is the knowledge to action cycle, but don't get too worried. We're not going to dive too deep into this. We just wanted you guys to have a basic knowledge of what it is. And so this was developed by Ian Graham and his colleagues, and it's what has really guided much of our work in implementing these evidence-based inclusive programs into communities across the US. So again, don't be scared of the big picture framework and the cycle, but just know that the knowledge to action cycle aims to identify where those gaps are between what we know through research and evidence and then what we do in practice, what's actually being implemented. So the steps in this cycle are designed to take that evidence and adapt it to fit into whatever the specific context may be. So we know that when research says to do something and that it works, just telling someone to go and do it doesn't work. So these steps are there to implement that, whatever that something is, and to make sure it'll work in all of those contexts, which are usually, every context is different, it's complex, it incorporates a lot of different cultures and people and all those things. So it takes all of that into consideration. So the purpose of following this framework is really to just slow down the implementation and to make sure that it's done in a way that will be well received, that uses the resources that are available in that context, and tries to make sure that the barriers that are creating those gaps are really addressed. So NCHPAD uses it to implement programs within a community. Excuse me. So we may have a sense of what factors affect change in a given community, but we're not the local experts in that community. So we don't presume to know what the local factors are, like the community members or the culture or the resources, because if we did, we may miss the mark and implement something that's not going to work. So one example that just briefly touches on this, we had a community reach out, or an organization locally reach out to us and say, hey, we're hosting this inclusive 5K. Will you please advertise it and tell everyone about it? And so we said, well, maybe, but can we take a look at the 5K course? Because in Birmingham, it's actually really hilly. And so we went and did the course, and it was like the most ridiculous hilly. There was no curb cuts. There was like the largest hill, I think, in Birmingham on it. And so we just had to go back to them and say, hey, did you have anyone with a disability? Did you ask your community if they wanted to participate in this? Or did you ask someone with a disability what they thought of this course? And of course, the answer was no. And so that's just one tiny picture of maybe ways that we can show you that you can, by engaging your community, you might get a little bit more feedback from them and buy-in from them. Next slide. So this is just making sure, this is the, this is what our grant looks like. So the NCHPAD's Inclusive Community Implementation Process is what we call it. We call it NiCIP for short, because if you know anything about NCHPAD, we are all about our acronyms. And so right now we're actually funding 5 states to implement this work and to try it out. And so we are making sure, looking at Oregon, Iowa, Montana, Kentucky, and New Hampshire. And as I mentioned in the beginning, there's 19 states that the CDC funds to have a disability and health program at their state public health level. And so all of these are states that had that, and that's how they were able to apply for this grant through us. And on the right, you can see programs that they are implementing. And so these are programs that we've gone through and adapted to be inclusive of all individuals. And so they kind of run the gamut across the lifespan. We have Go for Life, Girls on the Run, Prevent T2 for All, which is a diabetes prevention program, SNAP-Ed, and BMI Squared. So those kind of reach all age groups, and this is where we are kind of working through this process ourselves right now. Next slide. So here's a graph that explains kind of what the NiCIP process is. The NiCIP is built on the community, so that's why it's all about community engagement. It is expected that representatives from the communities really drive that implementation of whatever you're trying to implement from the beginning. So that means it's something that they want, It's something that the community believes in and that they're committed to seeing it through. So by getting the community on board through this process, not just presenting the outcomes to them at the end. So letting them really feel like they have a buy-in from the beginning, and they truly do have a buy-in from the beginning, really builds that community and is needed to make sure it's a successful program and a sustainable program. It's just a lot slower process. So instead of coming in and saying, oh, I have this program, you're coming in and asking the people, what do you want and what do you need and what would you like to see? Next slide. So in this framework, there's really three major components. And so we're going to take a look at what these three components are and how they affect community engagement in your context. So the first, or the three components are, one is stakeholder input, which is key, and we're going to talk a lot about that. The second is time and effort. And then the last one is sustainability, because we want it to last and we don't want it to just be a one-time effort. Even within our grants, they have to be able to show that this work will continue even after the funding is not there from us. And so that's a big part of what we want to see, is real, true community change for people with disabilities. Next slide. So the first one, like I said, is stakeholder input. And so we're going to talk about who should be giving that input, who should be your stakeholders, and who's at the table currently and who maybe needs to be at the table. Next slide. So we talk a lot in our world is inclusive health coalitions, but often that's an unfamiliar term to folks. But this is really the first step in the framework to really mobilize an inclusive health coalition. So I think some of you guys, if you're working in the adapted sports world, you may have like advisory panels or a board, and that's a great place to start. That can start the process of this inclusive health coalition, but I'll read the slide here. It says, diverse groups, an IHC or an inclusive health coalition is a diverse group of community leaders and organizations that explicitly promote disability inclusion in programs and services related to physical activity, nutrition, and weight management. Their efforts focus on the removal of barriers that prevent people with disability from achieving the same health opportunities available to community members without disabilities through adaptation and changes to the community health policy systems and environments. And so we're looking for this group, this health coalition, to really be able to make sustainable change for the organization and for their community. Next slide. So typically the framework helps you identify this, the NiCIP framework helps you identify a problem and come up with a program that is a solution. But in this case, you guys, most often, and those of our grants were the same as well, already have a program. So if you are a disability sports organization, then you already have the program that you're wanting community engagement for. But that doesn't necessarily mean that you've built the trust within your community or have the right people at the table. So you can, by going through this process, and if you already have a program, you're able to build trust with your community. You can have large community change. You can really slow down and ask them what they want, and that's going to increase your social support. Secondly, you can identify barriers within your community for people with disabilities. Even if you're a disability sports organization, if you haven't asked them maybe what the barriers, maybe we aren't aware of that. And now we could give lots of examples of folks that serve people with disabilities on a regular basis, but still have kind of missed the mark in some areas by not taking their step, slowing down and taking these steps. And then the last one is to identify assets within your community. So being able to mobilize and share resources. I think this has been, right now during COVID, I think that's been a beautiful example of how this works. So you're able to show the benefits of working together, sharing resources. I think Move United has done a great job with their Adapted Home by taking the resources that so many adapted sports organizations have put together and putting it in one place, because the goal is helping people with disabilities and not individualistic goals. And so I think that's a great example of what this could look like when we slow down and make sure we're using the right process. Next slide. So who should be on your IHC? Who should be on that health coalition? And so again, I just emphasize that they might be starting with a disability organization, but that doesn't mean that people with disability are at the table. And there's a really big difference. So what does your advisory board look like? Are people with disabilities sitting on your advisory panels or with your board? So you want to make sure that you're recruiting a diverse relevant multi-sector membership. You want to think outside of the box of who may typically sit on your board. If they all look alike, they all live in the same neighborhoods, they all have the same backgrounds, then that's not really what we're going for to make sure that we're addressing all the areas. You want a cross-disability focused representation. So just because there's one person with a disability, or you may have one voice of disability on your at your table, that doesn't mean that you can speak to all disability types. And so you really want to make sure you have representation from a multi-sectional board. You want to make sure that you partner with disability agencies that also have a cross-disability focus. So even if you are a disability organization, there are probably other disability organizations in your area that you could partner with to kind of help bring that focus to your community, to a larger audience. You want to include family members and caregivers, or whoever the support people are for the people that you're wanting to serve. And then local thought leaders or opinion leaders. So whoever in the community has a loud voice is one that could be great on your IHC. And then organizations and individuals, so both at the larger level as well as an individual level. And then experts in a variety of different experiences are key to have there. Next slide. And I just want to point out that there are some potential stakeholders or IHC members that may not be there permanently, and that's okay. So when you're putting this framework together, this IHC, that's really kind of the key component to how this whole thing works, think about who is important to have for different sections of what you're working on. So some stakeholders might join you only for a short time to help with something really specific, or they might join for a longer time, but that's okay. We really want their voice as long as they can play that key role and help with community engagement. Next slide. So facilitation of an inclusive health coalition, what does this look like, and how do you facilitate one, and how do you bring all these people together to a table? So the first thing that's really important is to make sure that you have a stated mission, and that shouldn't be the mission of your organization. So this committee should really have its own mission and whatever is that driving force of what their goals are going to be. So there can also be subcommittees and work groups. So you just want to make sure that every member has a purpose and a role so that they feel heard and that they continue to come back, because it's going to be vital that their participation is a part of that voice that makes decisions. There should be regular meetings and consistency in how you communicate with them. So again, that they feel heard on a regular basis and that their input is being used on a regular basis. Whoever is going to kind of lead that IHC should really have some facilitation skills, or be able to just really be able to clearly state what their vision is, what they want to work towards, and they should be able to inform their IHC of whatever the ask might be. So if their job is to do some type of assessment or to do some type of survey, they really should know all there is to know about that survey or why they're doing that survey assessment. They want to motivate and persuade the stakeholders so that there's buy-in. Again, so they're soliciting their support for whatever it is. And so that's how you get that community engagement, is when you start with this number, these people around the table, and you get them and they're able to go into their communities and solicit that support from their community members. And it really just fosters a team development. So they feel like they're working together, they're on a team. These may be people who would never be in a room together. And all of a sudden we're giving them an opportunity to not only be in the room together, but to have an equal voice. And so I think that's, really one of the key components to how this really operates together. Before I go to the next slide, I noticed that we have a couple questions in our Q&A, so I'm going to read them really quick. One is from Russ Meyer. We use an action research model for our program development. Is that paradigm a part of your knowledge to action paradigm? Casey, I'll let you answer that one.
Yeah, so the knowledge to action framework was actually built on, I think it was 31 planned action models kind of combined together. It's part of just kind of knowledge translation. So it really is just taking the time to plan out those steps and make sure that you're finding the gaps and then addressing those gaps with evidence. And then once you have that evidence, how do you make it fit the context that you're in? and meet the needs of your community. So yes, it's based on the planned action theories.
Thanks. Our second question says, how do we find out or talk to within state government to look into implementing something like this in Colorado? I'll start with an answer to just say that a lot of mayors have a mayor's department on disability or similar names. And so that's sometimes a place that you can start. But a lot of times it's in the public health sector is where we work. And so that could be a place that you could start to move and then ask those government officials to be a part of your IHC. So you don't necessarily need them to start one, but you could ask them to be a part of it so you have their voice, and that would be a key leader from the community. But Casey, would you like to add anything to that?
I think you got it.
So you don't need the state government to start one. You can start one on your own, but invite them, someone. That's a great example of an organization. So maybe the same leader can't always come to your IHC meeting every month, but someone from the mayor's council or something like that could attend your meeting every week. The next question is from Dana, and it says, do you have any outreach material highlighting the benefits of including individuals with disabilities? I have these conversations often, and people sometimes understand it, something that they should do, but it doesn't always bring them to action. What has worked? Amen. Sorry, we're in the South. But I think that that's a super common question or comment even. If you could submit your email, I would have to ask, well, unless Casey, you have it, I would get with one of our coworkers, Chris, who would probably have a little bit more information on the some documents about why it works or how it works, unless Casey, you have some off the top of your head.
Okay. I don't know.
Okay, so if you, Dana, if you could somehow get us your email address, we can definitely answer that question for you through one of our coworkers who works in that sector. Last question is from Ronald, and it says, is this Dr. Davis in Texas? It says, do you recommend having someone from legal on your team? If they have a voice in the community or they need to have a voice in the community, then absolutely. I think the key is to make sure that your IHC is diverse and that you have everyone on it. So the best would probably be, here in Alabama, it's called like ADAP, but it's the disability lawyer section. So someone that knows that space well would be great to have on an IHC. One more question, it's from Carrie. It says, has there been discussion or consideration of paying people with disabilities to be part of these committees? If staff members of other organizations are being paid to be part of the meetings as part of their roles in an organization, then the community members with disabilities should be paid too, it seems. 100% yes. So if anyone is being paid, absolutely community members or people with disabilities in particular should be paid. For people with disabilities, that's a service that they're providing that you can't get anywhere else. We need that lived experience, and so they absolutely should be paid for their time. That's best practice for sure on anything. I mean, even, you know, in our space, we are a pretty small organization, just a few people, but even when we're trying to do videos or something like that, we always try to respect the fact that that is their knowledge that they know. And so even if we're asking them to be in the video, best practice is that they are paid. So absolutely. I just lost a question that I don't think I answered, but that's okay. The next one is from Frank. It says, how do you control the stakeholders in maintaining the diversity of the program? How do you control the stakeholders in maintaining the diversity program? I think that's primarily upon who you invite to the table. And so if it's your IHC, then you're in control of who those stakeholders are and who you're bringing to the table. Now, I guess if you ask an organization, they could send whomever, but it's really the IHC's leaders' role to make sure that they're offering this and making sure it's a diverse community. And so actually, we are currently working on a one-pager on how to engage the disability community and what that might look like in a rural setting or in a city. So I think it just takes a lot of work, and actually in our grants, that's sometimes been the hardest. In some states, it's the easiest. They know exactly where to go to in their disability community to find that voice. And in other states, it's a lot harder for them to make sure that they are finding a wide, diverse range of information or of folks to sit at their table to get the right information. So I think it takes work on the IHC's part to make sure that it stays diverse. Andy Miller has a hand raised. I'm happy to take that question, or you can type it in to the chat, either way, however that works.
Andy, if you could type your question into the chat, we'd appreciate it. Thank you.
Thanks. So we will move on to the next little section. And as questions come up, I'll try to let Casey finish a slide and then bring up the question.
Thanks, Kelly. So I know it probably sounds like a lot of work, but doing it right is going to take a lot of time and effort, like anything in the health and sports world. Building those bridges to the community won't happen overnight and won't happen without time and effort. And so the quick fix sounds better in the short term, but unfortunately it's not likely going to be a sustainable path. So it's not always the easiest way, but it's a better way to try to build those long-term and sustainable partnerships. And so it will pay off if you take the time and effort to really reach out to the right people and maintain those relationships. So I'm going to talk about two different pieces of the community engagement. So first, how do you engage people to serve on your IHC or to invest in your mission and work? And we're going to look at some principles of community engagement, and then we'll talk about some broader community feedback and what it might look like to build upon what your IHC does and your mission and your work. So first things first, you want to make sure you maintain engagement of the people who are already at the table. Many of you probably have people who are your athletes that are your best spokespeople, your longtime supporters, your volunteers that keep coming back, your parents of young athletes that truly believe in your mission. And you want to make sure you're keeping those people engaged and not losing those people as you're searching for expanding your stakeholder base. So many of those people are at the table already because they believe in what you do and they have an interest in your programs, and they're probably willing to help if you ask them to support in some different ways. So some examples might be helping to decide on and guide new initiatives. So being important and innovative is super important these days and for new grant funding and things like that. So asking them, what's a way we can move forward or move in a different direction or add on to the programs we already have because you're so familiar with those things. So one role that I have at Lakeshore is leading a lot of different evaluations, and we recently did a survey asking parents what kind of programming they wanted to see at Lakeshore different, or if they were happy with the programming, things like that. So you can take a survey like that and bring it back to the IHC and say, hey, these are what people are saying. What do you think? Which direction should we go? They're also the people who are going to be able to guide you to other people who might be able to help you. So you never know the expanse of people's networks or where they reach or who they're friends with. So you could, have that connection to the local government that you didn't know you had through someone that's already part of your stakeholder base. And then just including them in some meaningful work. We, within the IHC, within the NiCIP framework, we try to look at getting stakeholders involved in assessments. And so a lot of the assessments we do are looking at the built environment, organizational readiness for being inclusive, some trainer readiness for if they're ready to provide inclusive programming, and kind of figuring out where the community is starting from, and having an extra set of hands and people with some lived experience doing some of those assessments is invaluable. And then another way is just development of content, material, programmatically, marketing materials, things like that. People have a lot of skills that if you ask them, they might help you. And a lot of people, from some of the sessions I listened to earlier this week, there's a lot of people who are probably operating on small staffs and small departments, and having extra set of hands to be able to pour into some of that work is really helpful. And then finally, evaluation is super important, especially to show the impact that your programs have on your individuals, on some of the broader community. Being able to show an impact through numbers and having extra set of hands to be able to ask those questions and read through what people are saying and make up some of those reports or running those reports by other people to say, hey, did I miss anything? Those are just a couple ways that you might be able to engage people that you already have at the table. But you probably also are going to want to reach out to new people. So a couple things to think about before you actually get to the steps of community engagement is defining what that means. And so community and engagement both mean a lot of different things to a lot of different people. So first, when you think about community, who are you defining as your community? Some people will define it geographically, some people will define it by an identifier. These days you can identify as a specific social media community, as a specific, Taylor Swift has its own community, Beyonce has her own community. There's all these different communities that intersect, that you want to make sure that you know who you're talking about when you're talking about community. And when you're talking to different people, doctors might be calling their community patients. Business-minded folks might be talking about consumers. And it automatically did things for me. So just define who your target is and what language you're going to be using to address those individuals. Same with engagement. There's a lot of different ways to engage people and a lot of different terms that people use. So participating, engaging, involving, collaborating, consulting, and partnering. So all of these things might mean different things and might mean a different level of engagement. A lot of times when you think of a partnership or consulting, you might think of a fee involved or a specific MOU or contract. So is that part of it, or is it just reaching out and talking? So just defining, what do you mean by community and what do you mean by engagement?
Casey, we have a quick question, and we're also at a 15-minute timer.
Right.
The question was, I'm interested in starting an adaptive hiking program tailored to those with a traumatic brain injury. Who should I invite to the table?
So I would say, A, people with traumatic brain injury, likely their family members or caregivers, people from Parks and Rec departments. If there's anyone who has experience in kind of the built environment, and I'm trying to think of like a landscape architect or things like that that might know about things that you need to look for in the environment. Kelly, I know you've done some work with.
Yeah, I would say you hit the big ones, making sure those with a traumatic brain injury, their caretakers in the Parks and Rec, and then whatever trail systems it is, and then again, still community leaders in that area. So I think you might have to get creative. Again, we don't know the context, and that was one of our first things. Like, as you work through the process, we would have to know that community better, and maybe as we go through, we might answer that a little bit more for you as well. We had another question I'll answer really quick because we're almost out of time. It asked about our directories on our website. That is self-populated. So if someone doesn't update their own directory, then it doesn't happen, but we don't manage that. It's just self-populated. Okay, go for it.
All right, so I'm not going to go through every bit on this table, but the continuum goes from outreach on kind of the lower end, which is where it's very one-sided communication. You as the person who has the information comes and gives it to the community, and there's not a lot of back and forth. And then going from outreach all the way to shared leadership on the other end of the continuum, where it's truly a joint effort going forward. And then in between there, you have consulting, you have involving, and you have collaborating. And so you just want to kind of take a minute to think about where you and your organization might be on that continuum already, and where you might want to be on that continuum to provide a little bit more empowerment to the community, allow a little bit more guidance by the community itself. And it's just important to, a nice way to think about the different levels of engagement that you might be able to have with the community. So as you're kind of thinking through where you are in that process, what counts as engagement and participation to you, and where does your organization fall on that continuum? And then what view do your community partners have of those same things, and are you on the same page? And it's going to be a process, it's going to be collaborative, it's going to be coming to those definitions together. but just making sure that it's not strictly trying to find input from the community. And Lynn Morgan has this thing called the definitional divide. And so a lot of times, especially in kind of the research world, we might do a utilitarian approach where we're trying to accomplish the aims of a project. And so we go to the community to check a box and ask them to say that we've asked them. Whereas empowerment is on the opposite end of that, where the community takes some responsibility for solving those problems. Within the NiCIP, we want the IHC to guide every decision involved in defining the health problems and mapping solutions and identifying barriers and resources, and then ultimately to help implement some of those things. And as an empowered community, they'll likely believe and support it more. So obviously it's the more difficult way to go about it with this empowerment model, but there are some definite advantages to community engagement. So you can kind of view a health problem as a whole health problem. So you might be able to look at some different levels of the socio-ecological model. So instead of just looking at the individual, are there some community factors? Are there some policy factors that might be able to increase involvement in your programs? A colleague told me once a story about a weight management program that was taking place in a community setting, and everyone was super gung-ho about it and really liked the program, but no one was showing up to the classes. And until she asked them, she didn't know why. And when she asked, it was because there was a pack of stray dogs outside the building. It had nothing to do with the program. It had nothing to do with the content. It had something to do with just the situation that then had an easy remedy to change locations. Or I'm actually not sure what the remedy was, but there's a lot of different ways you can go about solving that problem once you know what the problem is and once you know a level to address that problem. Community participation has an indirect effect on health. They're involved. Encourages shared ownership of the program, facilitates the development of the interventions that are integrated into existing things within the community, and it can be very cost effective. We also know there's some challenges. Implementing with community relevance is difficult. You're gonna have to make sure you're representing the larger community, and there are some power differentials coming in as the organization versus, you know, seeing the community members might view the organization as the one in charge and authoritarian, and so you wanna make sure you're on the same level, and that everyone has a role, and just gear up for a complex and possibly time-consuming process. So cultural competence is a major thing that's important in this work. So make sure that you're checking the biases that you're coming in with. What background are you coming with? And is that the same background of the people that you're trying to meet? And then just making sure you know and have competence and literacy about the social and cultural systems that you're trying to provide services in, which may be different than the views that you have. Ultimately, it is a two-way street. Community engagement is a two-way street, and the my way or the highway approach is probably going to end up with someone hung out to dry, and probably isn't going to build that sustainable relationships. So making sure that it's a respectful relationship in both ways. And then just understanding the community, understanding who you're talking about, who those key people are, what are the important issues, and what is the culture that you're trying to, of the community that you're trying to be involved with. And then the resources that it's gonna take, including time and including expenses to do that full engagement. I know we've been talking about the shared decision-making approach, but there are times where feedback and just feedback is appropriate. It's sometimes needed and sometimes not. It doesn't have to be formal, but you may be able to ask additional stakeholders that what their feedback is on some of the things that maybe your IHC has developed, and you just need the broader community to double check that you got it right and that you didn't miss anything. Because having, you know, everyone in the community on your coalition might end up with just way too many cooks in the kitchen. And so this is a way to just kind of double check everything that your small group has devised. It could be a really formal process. It doesn't have to be. You may get a lot of feedback. You can incorporate it or not, but it's important to let the community of people that participated know what feedback was incorporated and how it was used, and then who you talk to. A lot of times I've been a part of committees where you give input and you have no idea what happened with it afterwards. And so it's just important to maintain that communication anytime you're engaging the community. And before you do that, before you go to get that feedback, make sure you have that plan. You know what you're going to be talking about. You know who your audience is, and you've considered the wide range of people who might be those stakeholders. You've thought about all the relevant players and agencies that might want to be involved. And you just have a plan going forward about who's leading it and what resources are going to be needed.
Casey, we got 5 minutes.
I'll go real quick. So there's a couple different methods for collecting feedback. And just a couple things to think about is, are those methods really focused on getting a certain type of person? So for example, an online survey, you have to have internet and you have to have a device able to do that survey. So just thinking about who are you missing if you're only doing an online survey. And then there's public forums, focus groups, interviews, charrettes, newsletters, event booth table. There's no formula for that. But just consider some of those different ways that you might be able to do some of that. Skip over that one for now. So the ultimate goal of the NiCIP and of any program implementation is sustainability. So the Office for Adolescent Health has a great model for the factors of program sustainability. So just thinking about how are you creating a strategy to plan for sustainability? Have you assessed your local environment? Do you have the leaders engaged and developed? Are you being flexible so you can evolve and adapt whatever that is? Make sure to communicate, make sure to integrate the program into the existing community structures, building those partnerships, and then looking to diversify and secure funding. So right now we have the right people at the table. We've gathered some additional feedback from stakeholders. We have the program we want to implement, and we want to plan for sustainability. And so what next? And Kelly's going to talk a little bit about what we do next in the NiCIP.
In all of my 2 minutes to discuss. So we use a framework called the grades, which is guidelines, recommendations, adaptations, including disability. So if you guys are looking at a program that is not currently inclusive, this is an evidence-based way that we can, or a way that we can maintain evidence-based in a program while adapting it to be inclusive of folks. So if you guys have questions about how we do that, those programs we mentioned, those that the 5 states are doing, this is the framework that we use to adapt those programs. Any questions about that, feel free to reach out to us afterwards. Next slide. I'll give you one example. Casey kind of mentioned this earlier of how like the dogs being at the entrance and why that was a problem. So sometimes the implementation that we think is without that community engagement is just, we're missing it because we don't have the feedback that we were looking for. So one example from one of the states that we've been working with is they had a diabetes prevention program, and their focus was really to get folks with the disability to the program. And so they couldn't understand why folks weren't coming. They didn't get it. But then after talking to the individuals, they realized that doctors weren't telling people with disabilities that they were pre-diabetic. So they didn't even know that the program was for them. So then they realized that there's a whole big piece missing on their IHC, which was doctors or the healthcare system, in making sure. So sometimes it's just, this process just works to help identify those areas that maybe we thought were solutions, but aren't really the problem. So they're not the solutions that are gonna work. So it goes through really doing an assessment and taking that feedback from the community to make sure that we're addressing what we need to address so that the solutions really work. Next slide, and you can skip the next one and actually go to the last one. And so what does this mean for you guys? I think the biggest thing here, because so many of you guys are adapted sports programs or you work in the disability community, is you have 2 communities that you're looking at that you want to make sure is having input on whatever your program is to get that community engagement. So one is the disability community. You serve people with disabilities, they have input on what you're doing. So have you asked them what they want? Are they involved in the process from the start to the finish? Are they not just like somebody over here is creating a 5K and then after they create it, they say, hey, do you want to come and participate in my 5K? Or do you gather the folks around your table and say, what do people with disability want? It's not a 5K, it's a softball game. So then you implement a softball game. And so making sure they're there from the start to the finish, and then helping them to conduct assessments and really see where the gaps are. So that's the disability community. On the other side, you have the surrounding community, the engagement that you want from those people around you. So have you asked them what they want out of your organization or whatever program you're providing? Are they also involved in the process from the start to the finish? So they, again, don't feel like they're just being invited to come watch a competition, but they feel like they had input and they know the team from the beginning. And then the last one, do they see the need for what you guys do? Do they understand your purpose? And so that kind of sums up the whole thing that we've talked about today really quickly, is looking at that and getting that community engagement from both ends. So we want to thank you guys so much for attending today. We really appreciate the time that you guys have given. We know these are unique circumstances. If you guys have any questions for us, some of you may have already checked out our website, but we have a live chat on that website that you can ask us any of these questions that you've had, or you also see our emails on the screen.
Thank you, Kelly and Casey, so much. And thank you to everyone for attending. We're so excited to see so many of you interested in this topic and interested in getting resources afterwards to help engage your community. Please, take a screenshot of this, but we'll also make sure that you get Kelly and Casey's information so that you can follow up. As you're leaving, please take a couple of minutes to take the survey at the end of this session. Julianne is going to type it into the chat feature. You'll also see it in your browser as you exit the screen. Your responses will really help us continue to provide high quality educational opportunities for the adaptive sports community. You can also stay involved in the conversation around the leadership conference by sharing your thoughts throughout the conference on social media using the hashtag MoveUnited. Thanks again, everyone, and enjoy the rest of your day.